Myth-busting the COVID-19 vaccines. You should know that between 2010 and 2015, the World Health Organization estimates that at least 10 million lives were saved by vaccines. That means each year millions of lives are saved by vaccinating against diseases caused by viruses and bacteria. But there are a lot of myths about vaccines out there.
Myth 1, the vaccines were rushed. Busted, the vaccines went through the same steps any vaccines go through for approval. The technology used for the vaccines have been studied for decades. Scientists and researchers were able to move quickly because they built on existing research and knowledge. They were well-funded, and because millions of people have been infected, they were able to conduct safety and effectiveness trials. They didn't skip any steps or rush.
Myth 2. I'm young, so I don't need a vaccine. If I get COVID, I'll be fine. Busted. While many young people have milder symptoms, some young people still do develop the disease and some do die. And even with mild disease, many young people pass the virus to their loved ones with a much higher risk of serious disease and death. The vaccine doesn't only protect you, it protects the community and your loved ones. By helping to limit the spread of disease, you may prevent your loved ones from falling ill with serious or fatal COVID-19.
Myth 3. Vaccines will give you COVID-19, make you sick, or cause infertility. Busted. The vaccines do not cause illness and cannot give you COVID-19 because they do not contain a live virus. Shot side effects are your immune system readying for battle. Mild fatigue, arm soreness, and even low-grade fever mean your immune system is doing its job. Most side effects disappear in 24 to 48 hours. The vaccines also don't cause infertility. That's a false rumor that started on social media, according to the CDC.
Myth 4. I've had COVID, I don't need the vaccine. Busted. The Centers for Disease Control and Prevention recommends everyone, even those who have had COVID-19, be vaccinated. COVID-19 is a serious disease, and with time, immunity from natural infection fades. Early research indicates that natural immunity might not last very long.
Myth 5. New variants make it pointless to get vaccinated. Busted. The new variants we've been hearing so much about are more transmissible and may make the vaccines less effective, but they can still help protect you from severe disease and death because they produce a robust immune response. Viruses change and mutate all the time, and that's part of the reason it is so important that we vaccinate as many people as quickly as possible. The good news? Vaccines makers say they can alter the vaccines quickly and efficiently to combat worrying changes in the virus.
Myth 6. If I get vaccinated or had COVID, I don't need to wear a mask or practice social distancing. Busted. You still need to wear a mask, practice social distancing, and have good hygiene after getting vaccinated. This is because it is not yet clear if people who have received the vaccination can still get and transmit the virus as asymptomatic carriers. Hopefully, data about this will be available in the next few months. Until then, mask up and stay 6 feet away from people outside your household.
Myth 7. Natural immunity is better than vaccine immunity. Busted. COVID-19 is a dangerous disease that can cause long-term health problems and death. The vaccines allow you to build immunity without these risks. Some scientists believe that the vaccine provides better protection than natural infection.
Myth 8. The vaccine changes your DNA or gives you a virus. Busted. The vaccines do not change your DNA. Some of the confusion stems from the approved vaccinations that rely on mRNA technology. mRNA vaccines teach our cells to make a protein that triggers an immune response, but they do not alter our DNA or interact with it in any way.
For more information on these myths and the facts on vaccines, use the links in the description below.